I'm a doctor. She's a doctor. We're going to talk about the association, maybe, between autism and antidepressants.
Yeah.
Yeah?
Yeah.
I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter,
and we're Medical Moments. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
All right. We are doctors. We are going to give you the evidence-based information based on data about this. If you have an anecdote or a thing, that doesn't, not that it doesn't count. It's just that data, right? So you can come and say, my so-and-so had this and they did that and they have autism. That's not the data.
And we've all seen the headlines, right? On different newspaper articles like autism and SSRIs linked, or, SSRIs cause autism. And I mean,
it's clickbaity.
It's totally clickbaity.
And I think that's exactly why we wanted to do this video, to tell you the real information about what science says about the potential association between autism and antidepressants.
Yes, because even on those articles that news stations are writing about, if you go and read the actual medical article, it's not supporting what they're proposing.
Right. It's quick. I mean, they want you to read their stuff, right? Spend time on their website, do their thing, buy their thing, do whatever. Okay, so when we study autism, we often kind of put it in this realm of neurodevelopmental disorders, which is a mouthful. Sounds like a lot. What things are in that category? Autism,
ADHD,
intellectual disability or like a lower IQ, developmental language disorders, developmental
motor disorders,
behavioral disorders.
Mm-hmm.
So brain development problems, right? Yeah. Maybe not problem, disorder. Yeah.
And then also, a lot of these studies are looking at antidepressants. And so what do we mean when we say antidepressants? We're talking about SSRIs like fluoxetine, escitalopram, citalopram, sertraline, all those good ones.
Paroxetine.
SNRIs like venlafaxine, desvenlafaxine, duloxetine.
Vortioxetine.
And then also tricyclic antidepressants are often included, like amitriptyline or triptyline, clomipramine. And then bupropion is like kind of in its own little category.
Right. So that like kind of just setting the stage to like define some things. And then another really important factor we'll talk about a lot, so we want you to stay with us for this piece, right? Confounding variables.
Yes. So confounding variables are factors, other things that can influence the outcome of a study.
Okay, so confounding variables, things that can influence the outcome, right? Genetic, right?
Your family environment.
Yes. The reason that you're using the antidepressant and the severity of the thing you're using the antidepressant for can be another thing that factors in here.
Yeah, and I think just as a side note, like antidepressants are prescribed for lots of different reasons, not just depression.
Right, especially bupropion. I mean, that's used for smoking cessation,
which is also part of it, like smoking use.
Cigarettes, tobacco, cannabis,
alcohol,
yes.
Other drugs, prenatal care, like the quality of the prenatal care they're getting.
Overall health.
Their overall health, their BMI. All of those things are considered confounding variables.
Right. Other things that can play into the picture here. I think that's like one of the good definitions.
Yeah.
Okay. Yes. Okay. So let's talk about the largest, most recent study.
I was going to say, let's talk about the earliest study.
Sure.
And why we even got this idea in our head that autism and antidepressants or SSRIs are linked together.
Mm-hmm. Okay. Yeah, let's do it. Okay, so it's not just one study, it's like general early studies based on this. We're smaller, which is typical, right? When you're like kind of trying to figure out an association, fewer people have studied because you don't have the funding to do these bigger studies because you don't have any information to like say like, hey, fund my thing so we can know about it.
And back in the day, like technology wasn't where it's at today. So we didn't have like large databases of information like we do now. So they, it's like old fashioned enrolling people as they came. And when a study is small, it doesn't have enough numbers of people to look at confounding variables. We can really only do that when we have these huge studies.
Right. Right. I think the example that I use for that is like, think of, I don't know, one group of people, right? I'm not allergic to peanuts. You're not allergic to peanuts. We can't say the whole world is not allergic to peanuts.
Women aren't allergic to peanuts.
Right. Because we're not, right? Doctors are not allergic to peanuts, right? Like there's a lot of things that are at play here that could be different. So when you have a much larger sample, you can kind of tease out some of the more details related to that.
And then also earlier studies weren't as sophisticated and didn't even look at confounding variables. So they just looked at, here are a bunch of people who are on antidepressants versus here are a bunch of healthy control individuals, and we're going to compare which one is more likely to have children with autism. You can't do that because the people who are on antidepressants are very different from the people who are healthy controls.
Right.
There's all these confounding variables that are going on.
Mm-hmm. Right. So when we can talk about the newer studies, right? So the newer studies, most recent and largest study was on 3 million pregnancies. I think it was Elizabeth Suarez and her colleagues. They looked at 150,000 kiddos, right?
Yeah.
Who were exposed to antidepressants during the time where their mom was pregnant.
Yeah.
There's probably a better way of saying that. Anyway.
These kids were exposed to antidepressants during pregnancy.
Right. So basically they looked at the databases, and with this number of people, they were able to kind of tease out some of the factors. And basically what they realized was the needing an antidepressant or having depression or anxiety or whatever the thing is the risk factor. That being on antidepressant medications doesn't actually increase the risk of autism.
Yeah.
So when they were looking at those previous studies, they thought, oh, medicine must be the thing.
Well, I think it's really interesting because so for this study looking at these, 3 million pregnancies, before when they just looked at the data, like people who took antidepressants versus people who didn't, they did find an association with autism and with neurodevelopmental disorders. But then when they went in and finessed the data, they went in and looked at, okay, but what if we're looking just at women with depression? Or what if we're looking at, people who are smoking? And they went in and looked at all these different confounding variables, potential confounding variables. They found that it's not actually the antidepressant that increases the risk. So there was no increased risk association with antidepressants. It was an increased risk with depression and psychiatric disorders and actually were the issue.
Right, right. And I think that is the most important thing to hear, is that it's the underlying disorder, not the medication. And we have a lot of videos about the importance of mental health treatment. And we can see here that if it doesn't increase the risk, if it doesn't change the outcome, we really need a parent who's doing well.
Yes. Because that affects a lot of other health and development of the child and the fetus.
Yeah. Yeah. So if you don't hear anything else, the data that we have right now does not support that antidepressants cause autism.
Yes. And it's not just this one study. We have several other studies, but this was the most recent and the largest to date.
That's a very large study, right? Which is so wonderful that we have something like that. We talk about it all the time.
Yeah, it's awesome.
Yeah. Okay, please let us know what you want to know about, because we're happy to make videos for you to help you with the things that you need to know about. So subscribe, comment here what you'd like to see. We'll see you soon.
Bye.